right, and welcome back. It's now 27 minutes after 8, and today on Your Health, we're looking at teen health. And with me in studio, I have Mageda Esolio and Victor Rusugu. Let me start with you, Mageda. And sexual and reproductive health is a huge concern for the country generally, especially given that the youth are getting more sexually active at a very young age. Some because of the environment they're predisposed to, others by choice. But maybe since you work in that space and you interact with them, what are some of the things that you'd highlight as the main concerns when it comes to sexual and reproductive health?
So some of the main concerns when it comes to sexual and reproductive health for young people, when you actually go to the community and listen to them, most times is lack of access to information. They do not know how these things happen. They do not have any information. They do not have any place whereby they can access this information. They only go to friends and the internet to access sexual and reproductive health information. So that poses a big challenge to them because they do not know if the information is verified, if it's true, if it's correct. And when they want to access services, any service, go to a facility, go to a hospital, there's a lot of stigma around teens going to facilities and asking for information. So they find it very challenging for them most times. It's also a taboo conversation, sexual and reproductive health. So even for them, from a young age, they feel like it's not a conversation we can have. It's not something they want to open up on. So it's even a challenge just bringing them to that point to say, okay, I know about sexual and reproductive health. What do I know? What do I not know? They find it very embarrassing, actually, to talk about it. Yeah.
All right, Victor, what avenues do we have that open up this information, especially to those in less privileged environments? And I say this because sex education is something that was introduced into schools a while back. We've had NGOs and organizations that have been in the country for a long time, basically disseminating this information. So how else can this be done?
We have to look for more creative ways as a country. In 2009, the government started an initiative of putting up the youth empowerment centers. And the initial thinking was we would have 210 model youth empowerment centers. That fell in the crack. There were just a few, and then that was the end of it. And the aim of this was to ensure that young people can be able to access information from the constituency level in a very organized manner, in a manner that has the right content. But then, having said that, the other avenue that we have to use continuously is the school. And although we say that there has been sex education, but there is also, in terms of content, if you look at the content, it does not prepare young people to be able to take up these roles, to be able to understand their physical development, emotional development at that particular level. And therefore, there is need to redesign that particular curriculum,
content that they have,
and make it more comprehensive.
What is wrong with the content? Would it be that it's outdated, it's obsolete, it's
if you look at the content, mostly it focuses on life skills, and there is more to there is more to information just like other than the life skills. What happens to when I mature? How do I get this information? How do I know how to handle all these issues that I'm going through? And when I'm in a relationship as a young person, how do I handle all these kind of issues? Yeah.
All right, Mageda, one of the things I know that plays a huge role is culture, and you alluded to it in terms of it is a taboo conversation. Yet these are the people who would expect to give us the right information that helps us. Because when we seek it out there from our peers or from people that want to take advantage, then definitely it's going to be skewed. How do we overcome that? Because culture is something that's so ingrained and so rich in our society.
So in terms of culture, you can see that in our past, like Kenyan culture, that our aunties and uncles did that role. During transition, during our rites of passage, that young people actually had someone to go to and someone to talk to, an auntie, to talk to about their sexual and reproductive health. So going forward, some of those roles have been pushed aside, And our culture is changing, and we have to accept that our culture is changing. And so we have to change and actually introduce new avenues whereby our young people can access this information, because that's the important thing. So just saying that that culture was there and accepting that it is also African to give this information to young people, and seeing ways, especially in this age of internet and people going to Dr. Google and all these things, that how do we actually create that environment, that space whereby young people can actually access this information. And so creating a new culture going on, because societies change, societies shift, and our young people are shifting. They are accessing information and they won't come and ask the auntie and the uncle. It might be during the holidays, 3 months in, and we need to figure out another way, a new culture whereby our young people can access accurate information on their sexual and reproductive health going forward. And so one of those ways is, as my colleague has alluded to, looking for a curriculum whereby the young people can access age-appropriate information at school level, actually making it, even having clubs and having conversations about it. What if this happens to you? What would you do next? How would you make your choices and decisions? And empowering our young people to be able to make those decisions. As you said, there could be a predator. So our young people a young person needs to know that, okay, there's a predator, what should I do? What did we talk about?
How do I identify a predator?
Yeah, how do I make decisions? Am I ready for this? I'm in school. What choices can I make? Why am I in school and why am I not in a sexual relationship with someone, really? So empowering our young people to be able to do that for themselves and creating a new culture as we go along. And even in the church setup, it can still be done. That culture can still be ingrained in the church setup. So it's really looking for new avenues and just working as we go along.
All right, Victor, as we wind up, STIs, are those still a matter of concern for the youth? Because with the information that we've had, with the campaigns that we've had on HIV and AIDS, is that yielding any fruit?
Well, if you look at the issues around young people and STI, I mean, we can also see that the rates of infections are going up, and so that's really a worrying trend. And you can look at, you can see that young people bear the heaviest burden around HIV and new HIV infections, and those are very worrying trend. But then you can look at this, you cannot just look at it in isolation. You look at this and look at what are other issues that are coming up. We have seen reports on the increasing numbers of teen pregnancies, children having children and children having grandchildren. That is a worrying component. We have seen the incidence of young people and the unsafe abortion among young people, and this is a key contributor to maternal mortality among young people. So these are the issues that we have to look at. But more importantly, you will also realize that we are a country that is endowed with policies, but then our biggest misdoing is the ability to translate policies into action and evaluate the impact of these policies. That we don't do. We've had policies that when they were evaluated, we found out that, for example, over 80% of young people didn't even know that that policy existed, and that was the adolescent reproductive health and development policy in the formative stage. So we spent 10 years implementing a policy that the target audience didn't know about it. Yeah, so, but we cannot lose hope, because we are seeing, if you look at the county setup, they're coming up, you know, Migori County, they have come up with the multi-sectoral strategy on adolescent and youth health, and they've involved everyone, including the church and all these people. Kisumu County have developed a policy, Mombasa have developed a policy to respond to the needs of these young people, and we have to commend all these counties that have done that. And so we have now to translate this from theory to practice and take the lead. Yeah.
All right. As we wind up, maybe your closing comments, Mageda, and advice to the youth out there, because I know there's a good number that might be watching. But what are the key things that you'd like to inform them, especially in regards to their sexual health, sexual and reproductive health?
As we close out, I think my comments would be on the National School Health Policy that we currently have, that was created by the Ministry of Health and Ministry of Education. at the national level, and just asking that that be pushed to the county level, and that the young people out there that should know that these policies are there to serve them, and they can actually call the people to action, the policymakers to action when they see at their county levels that, okay, the pregnancy levels are going up. It's not only the young people who are to blame, that they should actually call them out if they actually find predators and all these things. And even youth-friendly services who are not youth-friendly should actually be called out by the young people out there. And really, that implementation should take place at the county level so that the young people can access services.
All right. Thank you very much, Mageda Osorio and Victor Rusugu, for joining us this morning on Your Health. And that's where we wind up this segment of Your Health. But